So this is the first of 3 panels that we're having today to talk about patients and the progress that they've made through n-Lorem. And I think we're going to start today by having Ryan to sort of talk about his journey to n-Lorem and his family history. And then we're going to turn over to Nelson, and he can sort of talk about the way he was sort of able to guide Ryan to maybe a diagnosis and some treatment. And I have some questions, and I'm going to try to hold a little bit of time at the end for questions from the audience, but we only have 25 minutes, so let's start. And Ryan, I know that both these gentlemen said they're very chatty. I'm going to turn over to Ryan first, and just sort of ask you, Ryan, tell me about the family history of your condition, or close to your condition.
When it comes to the history, that's kind of entertaining. Well, not entertaining, wrong word. But my mother had familial amyloidosis, and they found that during her autopsy after she had passed away. And then fast forward till, was it 2006 or 7 when he started working with my sister Kim. She was having just some general kidney issues. I think it was starting with stones, I thought, wasn't it? Or something along those lines?
No, protein.
Just protein.
Yep.
So wait, so your mother though, how old were you when she passed away?
I was just a year old.
Oh, okay.
I was just a little tiny squirt.
So you, growing up, did you know how your mother had passed?
Growing up, I knew it was from kidney failure, but my dad was pretty careful on letting me know why.
Yeah.
And then as I got older, I would get more details as I asked it. He was very open. The older I got, he was more open with everything. And then I was able to read the autopsy reports and find out for myself exactly what was going on.
Uh-huh.
And by having that in the back of my mind, and then with my sister Kim having that diagnosis, we were kind of curious if I was going to deal with the same things or not, because unlike Kim, I didn't have any symptoms.
And how old is Kim?
She was 45. She did pass in April.
Aha. So when did she first start having symptoms?
She would have been
About 26, 27.
Yeah.
And you're
I can't do
younger?
math. I am younger. I'm 3 years younger.
Okay, so this happens to your sister. Did you immediately think, oh no, this might be related to my mother, or what were you thinking?
Yes, it was a direct, it's got to be the same thing.
Uh-huh.
And based on how fast things progressed with my mother, it was, okay, what kind of timeline do you have left?
Mm-hmm.
And that's when she had started working with Mayo Clinic and Dr. Leung here. And that's when it gave us a little bit of hope, knowing that there is a specialist on this. Now for myself, it was always in the back of the mind, but it was during just an annual physical exam at the Veterans Administration. And the first time, it must have been 2006 when I did that, protein levels were a little higher in the urine samples that we always do for physicals.
Yeah.
And I was pretty active back then at that point, riding, a lot of biking around town, a lot of just doing stuff. And so they kind of attributed to that.
Yeah, that's muscle breakdown, right?
Yep.
Yeah.
And then the very next year, same annual physical again, protein levels were still very, very high, same as the previous year. I wasn't nearly as active because I started college. And that's when it was, we need to find why. So they started having me work with a, I can't think of the name now, kidney specialist at the VA.
Nephrologist.
Thank you. Mine's a little off, it's a Friday.
Yeah.
Started working with a nephrologist at the VA, and she immediately wanted to dig into it a bit more until we decided to do a biopsy, just to figure out if we're dealing with the same thing.
Yeah.
And that is when the biopsy came back as a positive for the secondary AA amyloidosis, and immediately I was referred to him, same as Kim.
So he'd been working with your sister this whole time?
Yes.
Right, so how was that going?
They were still trying to just find
Yeah.
what was going on, if I remember right.
So Kim, his sister, presented to me with AA amyloidosis, when she was in her late 20s. And all along, she never behaved like a normal AA amyloid. And we've been treating her, and even though we were thinking that we were succeeding, we were actually not, and her kidney function had continued to decline. And so when Ryan came, he presented very much the same way.
To you, so he comes to you because of his sister's history, right? Yeah.
Right. Yep.
And you think, okay, did that begin to change the way you thought about Kim?
No, well, yes, because so as hopefully I'll be able to show everyone a little bit with my slide the disease course. But yeah, Ryan and Kim behave very differently than all my other AA amyloid patients. And because of my experience with Kim, I knew that treating Ryan the same way is not going to produce the same, or it's going to produce the same result, which was not good. I wasn't able to stop the production of the AA amyloid. And so when Ryan came and had the same presentation, in fact, his presentation was even more, so normally AA amyloid is due to inflammation. There's either chronic infection, chronic autoimmune disease, or some genetic inflammatory diseases that cause the body to be inflamed. Mm-hmm. Ryan and Kim didn't have inflammation. In fact, all our inflammation markers are typically normal. And so that completely negated our ability to treat, because all of our treatments are anti-inflammatory immunosuppressant agents. So I knew when Ryan came and his CRP was completely normal that it would not work. And it explained why it didn't work with Kim either. And so we had to explore deeper.
Right, so at this point, you turn to Ryan and you say, I actually do not know quite what's going on. I haven't been able to figure out with your sister, and now also for you.
Right.
Right, so then what was your next move?
So actually with both Kim and Ryan, I had actually sent their DNA all over the world to be tested. And actually we come back negative for any of the known genetic diseases that would cause AA amyloid.
Such as what were you looking for?
So we were looking for hereditary and periodic fever syndrome. So there are 4 hereditary periodic fever syndromes. There's familial Mediterranean fever, TRAPS syndrome, which is TNF alpha receptor associated periodic fever syndrome. There's hyper-IgD, and then Muckle-Wells syndrome. And we've tested all 4 multiple times negative. We've sent it to the United Kingdom Amyloidosis Center, where they were running a broader gene panel, and that also came back negative for both of them. So I happen to be.
Can I? Sorry. So these keep coming back negative. What are you thinking?
Let's keep looking. The only thought in my mind is just there's got to be some reason. We got to keep looking, and hopefully we'll stumble across an answer. I was pretty young in the age. I'm in mid-20s. Was I feeling hopeless? No, not yet. Because I was, as a person who loves to troubleshoot anything, and I was always there's an answer somewhere. We just have to find it. So.
Okay, go ahead.
So I happen to be working with Dr. Blyer at Wake Forest and Dr. Kamak in the Czech Republic. And we had I've been working with them because they have a family in Czech Republic that had a mutation in the promoter region of SAA1. And so we thought, well, we struck out with all the other genetic testing. Let's try this. So I sent Ryan and Kim's DNA to them. They tested the promoter region, and it was negative. But then Dr. Kamak decided, I'll just sequence the whole SAA gene. And lo and behold, they found a heterozygous mutation. And this was very important because it explained why when we made the diagnosis with Ryan and Kim, we didn't find that mutation. So normally when we type amyloidosis, we do it through mass spectrometry. We do a laser capture dissection of the tissue, and we send it through the mass spectrometer. We use trypsin to digest the protein into different peptides, and then the computer paste it all back together and tell us what protein it is. When we did it with Ryan and Kim, it was ordinary AA amyloid. and that's why we didn't have a clue that it was anything different. Well, it turns out that the mutation was right at a trypsin splice site. So when we send the peptide through, the mass spectrometer could not see it because it was cut right at that site. And so now in amyloidosis, just because you have a genetic mutation doesn't mean that that is responsible for that amyloid. So what we had to do was modified our technique, use a different protease so that we won't cut that splice site. And then we sent his tissue through again, and lo and behold, we were able to find the mutant peptide.
And so how long after Kim first coming to you did this happen?
10 years.
10 years.
Yeah, so remember, without the DNA testing, we would have never known to go with a different protease to look for a mutant peptide. And remember, so in medicine, we use the analogy horses, zebra, and unicorn. So kidney disease is horses. AA amyloids are zebras because they're pretty rare. Genetic forms of AA amyloidosis with the hereditary periodic fever syndromes are unicorns. Ryan and Kim are unicorns driving around in a Cybertruck. I mean, that's how rare it is.
Got to get that in there.
I got to get that in there. They are the first in the world to have this mutation. In fact, when we were in a amyloidosis conference just 2 years earlier, and there was a panel on AA amyloid, the experts on the panel didn't believe our results that we actually found a mutant AA amyloid.
When you say that they're the only ones to have this mutation, you mean that specific mutation in that gene?
No, they are the first ones in the world to ever have a mutation in the SAA1 gene. Now, the SAA1 gene is a very peculiar gene. It is well preserved for over 400 million years. So it's been very well studied, and people have looked for mutations in this gene in the amyloid patients and never ever found one. So they are the very first.
Okay, so you get this information and you bring it to Ryan and Kim. What happens next? Well, first off, when you hear this, how unique you are, how did you feel about that?
To be honest with you, I was very happy because now we had a reason.
Yeah.
We had the cause.
This thing you've been looking for for, I don't know,
very,
how long?
very long time.
Yeah.
Yep.
Okay, so what happens next?
Well, this totally explains why none of our treatments in the past had worked for Kim. And so I knew that I had to think outside the box to come up with a different treatment. And I had been looking at ASO because ASO had been used to treat another form of amyloid called transthyretin amyloid, ATTR. And so I began calling around to see, is there an ASO that can shut down SAA1? And
who are you calling? Ionis? No.
So I had a contact in Ionis, and we had talked a little bit, but then he left the company, and I actually lost the contact.
Uh-huh.
But then I actually did contact Ionis again, and Ionis told me that it was too small for them to take on this project, but that they had this other company called n-Lorem. And so I got in touch with Stan, and I explained to him the situation, and they go, well, SAA1 is made in the liver, so definitely it's amenable to ASO treatment.
Yeah. And then what? They said, do you need to file an application with us, or what happened?
So I filed an application. Stan started working on that. And then what I had to do was file an IND with the FDA. So I got to work, and we had we called it an N of 1 trial because Ryan was the only one in the world who was going to be in this trial. So we...
And what about Kim?
So actually, the story was I had actually intended to have Kim as the initial patient. And I did that because Kim was single, and Ryan was married at the time and had a child, and this is a brand new drug, so I thought, well, Kim would be the better candidate because she was single, she didn't have any children, and if it worked, we could then use it on Ryan.
You're talking about riskier?
Well, we don't know.
Yeah.
I mean,
Right. This is an ASO that's being created specifically for one person. It's going to be a trial of one person. I get what you're saying. Okay.
Yeah, we didn't know the risks, and so from that standpoint, and I talked to Ryan and Kim at that point and said, this is my reasoning, are you okay with it? And they were both okay with it.
Yep, very accepting of that.
Yep, that Kim would go first, and then if it worked, it was Ryan. But then fortunately, after I submitted my application, Kim had a series of complications and eventually died from these complications.
Yep.
So can I ask you, so your mother has passed away, your sister's now passed away. Are you like, if we don't get this fixed?
Yeah, it was a bit once because the complications that Kim ran into, and that eventually caused her. It was basically an uncontrolled bleeding. Kidneys had to be removed, and we knew at that point her lifespan was going to be short.
Yeah.
So might as well just enjoy what she can. And when that happened, that's when I really kind of had this isn't going to be good. We need to find something. We got to work through something here. And that's when he had mentioned that he was working through n-Lorem to try to get something put together. And I was talking to him every couple of months going, have we got any more information?
Yeah.
Have we heard anything? And it was, we're just about there. And then finally, we're here.
So you talked to the FDA, you explained what you want to do. How did they, I know that they've been receptive, but what was their guidance for you?
So they were actually very helpful. As Stan said, we had a meeting. We met with the FDA panel. There were a lot of questions on how we were going to monitor for safety, how we were going to assess the response of the therapy. And one thing, so Ryan never does anything easy.
Nope. Gotta make it work for it.
So the ASO is targeting the SAA1 gene. Now, we don't have an SAA1 assay in this country. They have it in Europe. So fortunately, Dr. Kamak is in Europe, so I said, hey, can you do the SAA1 testing for me so we know if the ASO is working? Well, when he used the commercial SAA, Ryan's level was 0. So it was 0 at the beginning, 0 after we started. So we don't know if it was working or not. And I go, okay, we got to do something. So I said, we got to get a more sensitive assay. So we had to get an assay that was 1,000 times more sensitive than the commercial assay. And with that, we were able to detect a level. And when we started the ASO, his ASA level dropped by 80%. So it's only with this non-commercial assay that we were able to.
Yeah, where did you get this?
Well, so this assay is designed for more experimental usage, so much lower quantity than the commercial assay. But that also means that Ryan's SAA1 protein is very toxic because at normal levels, it was making amyloid, which again hasn't been heard of before. All AA amyloid patients have high levels, typically 10 times higher than Ryan's before they would even start forming amyloid.
Okay, so after the first dose, drops 80%. And when did you actually begin? Well, first off, the FDA helped set up this trial. You're going to be an N of 1, as we've talked about. When was your first dose?
We started that at the end of November, or the very first week of December of 23.
Okay, so about a year now.
Yep, just about a year.
Okay, so I don't know, were you anxious about this? I know this, so the other thing, this is delivered under the skin, right? This is not into the spine, right? So that, were you nervous about doing this? This is something that's never been put in a human being before. or did you just have complete faith in your physician, or what?
With the research that he was telling me about and all the work they've already put in, I was very excited. I wanted to, let's get this tested, let's see what happens. I wasn't nervous, even, okay, let's get ready to do this, we're starting it right now. I was just excited. Because it was just the work that was behind it.
Yeah,
So.
and this was, how long had we been waiting now at this point?
At this point, it was a year and a half?
Yeah, close
Yeah.
to 2 years.
Yep.
Getting through the FDA took some time. And then after that, n-Lorem had to finalize the formulation. Then I had to get my institution, the Mayo Clinic, to get the IRB, get the pharmacy involved, get the logistics. And so all in all, I think was about a year and a half when
Yep.
after I submitted the application.
Okay, so about a year in, what changes have you seen, and maybe what benefits have you seen, if you have, physically?
For me personally, on the physical side, probably a little bit better energy or a little bit better just kind of feeling. But for me, it was more of a mental thing than anything. Knowing that the kidney functions can get back to normal. Knowing that I can have just a longer normal life.
Yeah.
Knowing that with the little guy, well, I can see him till he's not quite such a little guy, or have his own even. Knowing that I can be around for that.
How old is he?
He is now 7.
7.
Yep.
And then,
So.
Nelson, what have you seen as far as metrics?
So what we've seen is that the kidney parameters stabilize. Now with amyloidosis, the response is slow. So I wasn't expecting to see a whole lot during the first year. What we were mainly looking for is no deterioration, and that's what we're seeing. We're not seeing any deterioration. We're probably starting to see a little bit of improvement in kidney function. So overall, we've been pretty happy with the results because he's tolerating the therapy quite well, and we're starting to see some stabilization and maybe improvement in the kidney function. So he's coming up on a year. We're going to do a lot more testing at the end of the first year to look at some other stuff. But yeah, we're pretty enthusiastic and excited.
You actually don't know the answer to this, but because it's set up as a trial through the FDA, is there an end? Is there like an endpoint that the FDA is looking for? Is Ryan in a trial for the rest of his life? How does that work?
So technically, the trial ends at 1 year. That's what we asked the FDA for. However, in order to give Ryan the drug has to be delivered through a clinical trial. So
Yeah.
Mayo Clinic is going to keep the trial going, and that's an ongoing question as to how do we keep this going, because to keep a trial going, there's administration expenses and things like that. And so we're still trying to work that out right now.
We have a minute left. I cannot believe how fast this went, but there's one question I want to ask you, Ryan, and then, I'll try to open up to the floor if we have time for that. But, medicine sort of progresses along like timelines. You can think about all the people who died because they got an infection before antibiotics were created. You can think about the people who passed away before there were antiretroviral therapies for HIV. And I think, there's sort of like a fortune versus unfortunate part of that. And for your life, I think, you may feel like it's very unfortunate about you had a mutation, one of the, extremely rare in this world. But also, do you feel fortunate that because it happened to you at a time where there's actually something like an ASO that may benefit you? You've got this balance between these two things. Do you think about that?
Oh, absolutely. With how fast technology is changing, with the people's desire to want to discover this stuff and work with it, I feel very fortunate that we are able to work with this night now.
Yeah. Yeah. I have 16 seconds. Are there any questions from the audience?
And no, I don't have a single basic physical side effect. I haven't felt anything. So
Do you actually,
normal.
do you drive a Cybertruck?
I do.
You do?
It barely fits in the garage, but it does fit.
Yeah. Any questions? And then we're done.
Perfect.
Thank you. Thank you.